Good morning. My name is Rose Flores, and today we're going to do Medicare 101. I work with ARC Benefit Solutions, and I'm going to be happy to assist you on the path to understanding Medicare because it can be confusing for most people. So first, let's go into a little bit about myself. Nothing fabulous, but just a regular person with dogs and a house and friends and all kinds of goodies. But let's go into the actual Medicare agenda. So we're going to go through the history, how original Medicare started, the different types of Medicare. So let's go into that. And of course, at the end, we're going to have questions. So make sure you write those down so we can address those at the end. All right, so here is just basically the bones of Medicare that was signed in by President Lyndon Johnson. It expanded to cover disabled people. It also expanded to do Medicare Advantage, which is different than regular Medicare. And nearly 63 million Americans have Medicare. So let's get into, so how do I get Medicare? So basically when you turn 65, you're eligible. When you're on Social Security disability for 2 years, on the 25th month, you're eligible. If you're over 65 and you're losing employer coverage, you're eligible. And then you can have Medicare Parts A and B. So let's go into what actually those are. So Medicare Part A covers hospital stays. It just gets you in the building, okay? Skilled nursing, hospice care, some home health care. Now, the home health care does need to be written by a doctor. The Part B is actually when you're seeing the doctor. So it is outpatient medical and surgical supplies, clinical laboratory tests, durable medical equipment, some preventive services. So let's go into the different parts. So in order to get Medicare Part A, you must work 40 credible quarters or 10 years. There are deductibles and co-pays for hospitalization and skilled nursing. Most people feel like when they have Medicare that it is a complete package, that they don't need anything. But in reality, the deductible on Medicare Part A as it stands in 2023 is $1,600. That's whether you're in the hospital 1 day or up to 60 days. And it's an event deductible, so that if you went into the hospital, say, in February, and then sometime in July had to go back into the hospital, you'd have to pay that all over again. So you do need something more than just basic Medicare to help you along with the cost. And if you're, as far as, enrolling into Medicare, if you are collecting a Social Security benefit check, you will automatically be enrolled into Medicare Parts A and B. You do have the ability to say, I don't want B, because Medicare Part B does have some costs associated with it. So just be aware of that. And then we're going to go on to the next slide. And you can do your enrollment into Medicare 3 months before. Don't do it before then. They get really upset. So it's always 3 months before your birth month. The effective date is going to be the first of your birth month. Okay, let's go next. And then Medicare Part B. Medicare Part A is at no cost to you if you work those 40 credible quarters or 10 years. Medicare Part B does have a cost associated with it. If you are making, less than, I believe it is 97,000 individual or 194,000 filing joint, it will be the $194.90 per month. If you are collecting a Social Security benefit check, they're going to get their money first. If you are not, they are going to bill you quarterly in advance so that they get their money first. So as far as Medicare Part B coverage is concerned, this is actually when you're seeing the doctor, lab work, durable medical devices, and emergency room. So there is a $226 calendar year deductible. Once the deductible is satisfied, Medicare will pay 80% of the approved medical expenses, and you're going to be responsible for 20%. Just remember that that 20%, unlike your group and individual policy, goes on into infinity. There is no out-of-pocket maximum. So keep that in be aware of that. Okay, so as we stated previously, Medicare does have a cost. Now, Medicare itself, if you are making over a certain amount, they are going to assess you an upcharge. They are going to be looking at your income from 2 years ago. So as you can see on the chart, I'm not going to ask, how much you make, but you can see on the chart that if you're going to be paying or receiving money for above $246,000 up to $306,000 filing jointly, then your monthly premium is going to be $329.70. That is per person. That is not husband and wife. Everything in Medicare is per person. It's always individual. So people say, my neighbors are telling me that I have to go on to Medicare. Yes and no. There's a lot of different things about your personal situation versus your neighbor's situation or your friend's situation. So we're going to be looking at if you were on a group plan, you may have better drug coverage on that. If you are a higher wage earner, rather than having those upcharged for Medicare Part B, the group plan might be much more beneficial to you. And then there's usually higher deductibles and out-of-pocket costs on the group plan. So on the Medicare side, typically you can have lower costs on your premium, lower costs on out-of-pocket with little or no deductibles, limited out-of-pocket costs, and usually the lower wage earners win on a Medicare scenario. So which way do we go? So Medicare has the basics, A and B, hospital, doctor. Then you need to have drug coverage. You need to fill in some of those gaps. So there are two very different ways to do this. One way is going to be the Medicare supplement, and the other way is going to be the Medicare Advantage. So let's go look into the Medicare supplement. It is Medicare supplements near everything that Medicare covers. So if Medicare doesn't cover it, which is more like, glasses, dental, that type of thing, then the plan is not going to cover it. So it mirrors everything that Medicare covers. When you have a claim, it goes directly to Medicare to be processed, then back to the provider, then to the carrier. So on a Medicare Advantage plan, that is a managed care scenario where your claims will actually go to the carrier, and the carrier will adjudicate those claims. So there's plenty of differences, options, different types of time frames that you can utilize. There are no family plans. As I said before, everybody is individual. Okay, so Medicare supplement, which is a Medigap, fills in the original Medicare, like deductibles, coinsurance, and copays. It offers plans are offered by various insurance companies. Usually we deal with the main players in the business. You can go to any provider that accepts Medicare. It travels really well. And usually you have a premium that you pay, but you're not so much involved in the actual claims, like, as a pay-as-you-go that Advantage plans have. So basically, you see the doctor, you do have that $226 calendar year deductible, and then after that deductible for Medicare-approved services, you really shouldn't have any other out-of-pocket. It's pretty inclusive. There are some things that, like we said before, Medicare does not cover. They are all given different letters. So Medicare has parts, like Part A is hospital, Part B is doctors, Part D is drugs. This particular Medicare supplement has plans, and they just love using that alphabet all over again. So currently, the most popular plans out there right now are the Plan G and the Plan M. They are more inclusive of the costs that people are looking for to be covered. And then they also offer some extra benefits like Silver Sneakers, Renew Active. They can give you discounts on vision and dental, but it's not a policy on vision and dental, it's a discount. And then they can vary the prices based on, the insurance company, the location, your age, your gender, your health status, and your tobacco usage. And here are the different plans that are available to you, okay? And you can see that each one can add a little bit more, like A is pretty much the bare bones plan. B adds in one more. C is pretty inclusive, but plans C, F, and high deductible F are no longer available to people who are aging into Medicare as of January 1st of 2020. So the government decided they didn't like that first dollar coverage being paid. So of course, when the government says, we're not going to cut, we don't want you to do this, the insurance companies come back and say, hey, guess what? We have this nice little plan G that we've been sitting here looking at, and it actually has a deductible, so it fits in with the rules. So that's why the plan G and the plan N right now are the ones that are more popular than the others. Part D, it's available to anybody who has a Medicare plan. You can purchase it from private insurance companies. The government just wants you to deal with A and B. They don't want to get stuck in the weeds with, the different Medicare supplements and Advantage plans and the Part D. So usually you will talk to an agent. And there's a lot of difficult and various things that you need to consider. So I always recommend that you do get in touch with an agent, hopefully me, to help you with that along the way. And of course, just because there's an upcharge on Part B, as in boy, there is an upcharge on Part D. So they will charge you, the carrier will charge you their premium, and then the government, these upcharge amounts will be taken by the government. Again, they are considered IRMA, income-related monthly adjustment amount. They're looking at it from 2 years ago. So if your income changes from 1 year to the next, they will adjust that income as well as your premium. So if you have an adjustment that needs to happen faster than 2 years ago, so you were employed and all of a sudden now you're unemployed and retired, there are forms that you can submit to the government saying, hey, I don't make that kind of money anymore, this is what's going on, and they will adjust that income and those upcharges. Okay, so let's look at Medicare Advantage plan. Remember I said Medicare supplement is one way to go, a Medicare Advantage plan is the other way to go. You can't have both, it's illegal. Oops, went too far. Okay, so these plans include Part A, Part B, and Part D. They are health plans that are approved by Medicare. They're run by private insurance companies, so that's why we call it managed care. And then they're similar to group coverage in the fact that there is a pay-as-you-go. So you go to the doctor, you're going to pay a copay. You go to a specialist, you're going to pay more. You go into the hospital, you may have to pay $300 or $400 as an example for the first 5 days, and then after that, they're covered. So they do come in HMO and PPOs. An HMO is where you have to stay in network. You can't go outside of the network, because if you do, you pay for the cost. A PPO, you can go in or out of the network. Of course, if you go out of network, you're going to be paying more of the cost. These plans, just like group, have an out-of-pocket maximum, and those can range somewhere from, say, the mid-3,000s up to $13,000. And of course, the $13,000 would be for an out-of-network PPO plan. So once you hit that out-of-pocket maximum for hospital and doctors only, even though it covers prescription drug coverage, it's hospital and doctors only, then you're covered at 100% for the rest of the year. The prescription drug plans have a whole different accumulator. There is a deductible, initial coverage, gap, that type of thing. And we can go into that just a little bit more. And you don't have to have any medical questions. Basically, you just have to utilize specific enrollment times in which to enroll in this plan. It is easier to enroll into a Medicare supplement and change to a Medicare Advantage plan than going into an Advantage plan and going back to a Medicare supplement, because there's no medical underwriting that is done on a Medicare Advantage plan, but on a Medicare supplement there is. The first 6 months you are considered guarantee issue, which means they're not going to ask you any questions. And then after that, let's say you're on an Advantage plan and 2 or 3 years later you say, hey, Rose, I'd love to, check out that Medicare supplement. You will need to answer medical questions, and a Medicare supplement company can say no. Basically, you're not going to lose your Medicare Advantage plan, but you do have to answer medical questions. So now, if you're coming from a supplement to an Advantage plan, since an Advantage plan doesn't ask medical questions, it's an easy transfer. But you do have to cancel your Medicare supplement to get into the Medicare Advantage plan. Okay. So it is more or less inclusive. It covers Part A, Part B, and Part D. It covers everything that Medicare covers. Like I said, there's co-pays, there's a whole list of preventive services that are covered. They will throw in some extra dental, vision, and hearing for you. Nice little perks. They also offer over-the-counter coverage where you can go to like a Walmart or Walgreens or whatever and get vitamins, Band-Aids, cough medicine, all those types of things at no cost to you. There is an allowance that they have up to, and it's a quarterly allowance, and basically you have to use it till the end of the year, and then at the end of the year it's all gone. So they do add a lot of little perks to it, so it's pretty cool. And they have like flex cards where they can enhance that dental, vision, and hearing. Some of them coming up now are actually giving you some money for meals, as far as they'll give you an allowance for groceries. It's not huge, but everything is working to make the plans better. Okay. So here's the difference between the two, the supplement and the Advantage plans. And I have people in both plans, and it really depends upon the person. I'm going to take a sip of coffee for just a moment. Okay, so a supplement has higher monthly premiums. Okay, so usually it's probably going to start in at about 120-ish per person for a Plan G or a Plan N, somewhere around 100. Advantage plans, they can have like a $0 premium. They can have, a cost for the premiums, but typically they're lower. On the supplement, the premiums will increase every year. So you get 1 year older, you attain that age of 66, your premium will go up, as well as they will look at your book of business. Excuse me. And they may put in an increase in that. The premiums on the Advantage plan usually stay steady. There's very little change in those. If it is, it's a few bucks. On the supplement, there are little to no copays or out-of-pocket expenses. On the Advantage plan, it is a pay-as-you-go, so you are going to have copays and higher out-of-pocket expenses. As we said before, the supplement, you can go to any provider that accepts Medicare, travels really well, all of that. Whereas on an Advantage plan, you do need to stay with network providers. In some cases, with an HMO, if you go out of network, you are going to be paying the full cost of the claim. And then the supplement itself mirrors everything that Medicare covers, and of course Medicare doesn't cover medications you get from a pharmacy. So you must get a standalone prescription drug plan with that. And then on the Advantage plan, the drug coverage is included into the plan in most plans. And then benefits never change on the Medicare supplement. It's federally monitored. They all stay the same. On the Advantage plans, they do change annually. Basically, they have been getting better. So that's a nice little touch. And then, like we said before, on the supplement, you may have to answer medical questions if you're going into a plan outside of the guarantee issue. And just remember, the guarantee issue is 6 months. It is triggered by your Medicare Part B effective date. And of course, the Medicare Advantage plan has no medical questions. So I'm going to switch back just for a second. And let's go into this. Here's kind of like a cost comparison, whether you go with a Medicare supplement or a Medicare Advantage plan with a Part D. On the Part A, obviously no cost. Part B is going to be similar. The supplement plans, they can range from $120 to $200. The Advantage plan, $0 to $150. The Part D can be $7 to $100. On the Advantage plan, it's included. So the totals can vary there. One thing about enrolling into a Medicare Part D plan, and I'm sure you've heard your friends say this, like, well, they tell me I don't really take that many medications, I don't need it, and they tell me it's voluntary. Well, the government has a very strange understanding of the definition of voluntary. They indicate that if you are 65 or older, don't have credible drug coverage, you should enroll into a Medicare plan, Medicare prescription drug plan, I should say, that it is voluntary. But if you don't, then they will put a penalty, and that's 1% of the average monthly premium for every month that you were offered a Medicare Part D plan but did not enroll into it. That penalty stays with you as long as you're on that prescription drug plan. So if you take very little to no medications, I recommend enrolling into a very inexpensive plan just so you don't get stuck with that penalty. So qualifications for enrollment into a Medicare supplement: anyone over 65 and has Medicare A and B, guarantee issue for 6 months, or if with a loss of group coverage, I always recommend that you get into a plan so that there is no break in coverage. And you have to qualify medically unless you're in guarantee issue. An MAPD, Medicare Advantage with prescription drugs. Any age, must have A and B. So A and B are the building blocks on both of those plans. There's no health questions. Enrollment is limited to certain times of the year, and we're going to go through that. And you can change plans every year during the annual election period, which is from October 15th through December 7th, with the effective date being the first of the following year. So, and usually if you're already on a plan, the carriers will send you out an annual notice of change. That'll kind of give you the heads up on what your plan is. You get that information more so prior to an agent getting that information. Our information starts on October 1st, when we can actually look into the plans. So, talking about enrollment periods, your initial enrollment period is a 7-month window, 3 months before the month of eligibility or your birth month, and 3 months after. It's always the first of your birth month that you're going to have. If your birthday is on the 1st, then it's usually the month before will be your effective date. The annual election period, as I said, was October 15th through December 7th, with the effective date being January 1st. These are calendar year plans. So basically, once you go into the plan, you are locked in for the rest of that year, unless you have a special election period, some sort of change, like a move or something like that. Special election periods, they're all all year long, depending upon, like, if you move from Ohio to Kentucky, that's a different, from one state to a next. Um, you have to move into another plan because it's a different service area, and everything is built around service areas. So you have to be Medicare eligible, and you must be within your service area. And so loss of group coverage, change in residency, low-income subsidy, Medicaid, those are all special election periods that you can take advantage of. Okay, so you can enroll through an agent, which I prefer since I am an agent. And we look at you specifically because there's so many moving parts, and Medicare is difficult. And if you, like I said in the beginning, what's good for your friend is not necessarily good for you. So we want you to reach out to us. We are at no cost to you, okay? We get paid by the carriers. We are licensed and appointed with various carriers, so we don't have a special preference. We listen to your needs, what's going on with you, and then we kind of educate you on what is available to you and how those plans work to see which one feels more comfortable to you. We also can get you enrolled. We're your advocate after the enrollment, so if you need ID cards, you have any kind of issues, we are here to help you. So, and as with ARC Benefit Solutions, we do send you out a letter or an email on an annual basis letting you know about the annual election period. So, we don't just sell you one thing and then walk away. We are always here for you. So as I always tell my clients, I am never more than a phone call away, and I can always help you. So, or I try to help you. Sometimes it's out of my hands, but for most part, I do help you, and I'll help you understand what's going on and whatever else is going on. As far as how to enroll, you can go through the carrier website, or you can always call Medicare 1-800-Medicare, and then there's Medicare.gov that you can enroll into. And then we do customize, as I said before, the plan to you. What a snowbird who lives half the time in Ohio and half the time in Florida is not going to be the same as somebody who, just stays in Ohio and really wants dental, vision, and hearing, wants to take advantage of the plan, maybe have limited sources. So there's a lot of reasons that what's good for one person may not be good for the other person. So there are many factors to consider: the resident address, income, your doctors, your providers. Do you want to have flexibility in seeing people, then you would probably be more in favor of going to a Medicare supplement. Whereas if you want to have the Medicare Advantage, we do need to confirm that your doctors are in the network, that your medications are in the formulary. And then we do need to consider your budget. So we take all of these things into consideration. We talk to you. It's a one-on-one basis. There's, it's not, one size fits all. So attached is my information where you can give me a call. And like I said, I'm never more than a phone call away. I'm able to help you navigate the very difficult world of Medicare. And in a lot of cases, there are situations where somebody will call me up and say, well, I was told I have to get Medicare. And after talking to them, the answer is no, you don't. So let's go down a couple of those paths. If you work for an employer and that employer has 19 or less employees, I highly recommend that you do get your Medicare, because the carriers on the group side today are looking at, they're making the assumption you have Medicare. So if Medicare pays 80% of the approved medical expenses and you're responsible for 20%, they're going to assume out of that claim that 80% is covered by Medicare. Excuse me. And they won't pay it. And then you're on the hook for that 80%. So if you have 19 or less employees, I highly recommend that you enroll in Medicare Parts A and B. If you have 20 or more, the employer plan plays first. So, why, if you're paying into the employer's plan and you're paying maybe 20% or 50% of whatever the premium is, you don't really need to have Medicare in a lot of situations. You can elect Medicare and come off of the group plan, and in some cases that's the right thing to do based on your income, your salary, what's going on. Because remember, the higher wage earners, it's more expensive for them to go onto Medicare because of those IRMA charts than it is for somebody who makes less than, say, the $100,000 on an individual and less than $200,000 on the husband and wife plan filing taxes. So you have to look at what those costs are going to be. Is Medicare, is your spouse younger than you? Okay. Some of them, have if I lose my job or I go off of my employer plan because they are the employee, then their spouse will lose coverage. So that's another scenario to look into. I mean, they can, if they are on that 20 plus or more, they can look into COBRA. But, there's a lot of little things out there that, you need to talk to people about, especially agents, hopefully me, and explain your situation. And then, there are a lot of times I'll say, no, stay on the group plan. When you're ready, come off, are you planning on working longer? Yes. A lot of us are. I'm a baby boomer myself. So there are a lot of different scenarios available to you. And it's best to talk with somebody who knows the ins and outs of Medicare and don't always rely on the group human resources. They do a great job for you while you're on your employer plan, but talk to an agent about Medicare and what's going on with that. So as you can see, here's my telephone number. Again, never more than a phone call away, and I hope that you give me a call so we can discuss your situation and advise you. And then let's go into the next one. Oh, here we are, questions. So if anyone has any questions, please let me know, and you can put them in the chat. And hopefully my lovely assistants, who I'm very technically challenged here, but my lovely assistants will help me with this.
Doesn't look like we have any questions just yet, so we'll leave the chat open for just a couple of minutes here.
Okay.
It's going to be confusing, so if you have anything, you got a Medicare gal right here for you. We do have a hand raised, but if you do have a question, please type it into the chat so that we'll be able to see it. Unfortunately, we can't put you guys on mute because it will be very loud and overwhelming to everybody once everything goes on. So just put those questions in the chat, and we can relay that over to Rose.
And I love questions, so please, 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 please put in questions here. So
do you have any? Do you have any words of advice for people who might be coming in on their renewals for this year? Anything that people need to know about that?
Renewals based on what? Their Medicare renewals?
Yeah. Okay.
The carriers themselves have not released anything quite yet as to their plan descriptions, but as I said previously, on the Medicare Advantage plans, those are getting better. Also, a couple of things about the prescription drug coverage. They are working diligently. They've already worked on the diabetic supplies. Many of you may know that if you take some diabetic supplies, they have capped that copay at a $35 copay per month per medication. And maybe not the high-end diabetics, but a good majority of them. And every year they are looking at 10 new expensive medications where they are going to put them into a more reasonable cost. They are not releasing those until, I believe it is October 1st, September, October 1st. And we're all crossing our fingers because we all have favorites that we want to see get reduced that are very expensive. They also have made some changes in the prescription drug coverage. In 2023, there is a $505 calendar year deductible. Most plans say that if you're taking a medication on tier 1, which is preferred generic, or tier 2, which is a generic, you kind of fly under the radar of that deductible. But then on medications on tier 3, which are preferred brand, tier 4 non-preferred brand, and tier 5 specialty, you do have to satisfy that deductible. And then once the deductible is satisfied, you'll either pay a copay, which is a flat dollar amount, or coinsurance, which is a percentage. So in 2024, it used to be when you got from the deductible and then you went into the initial coverage where you would pay either a coinsurance or copay up until you got to $4,660. Then the cost of your medications would become 25%. And then when you got to $7,400, then you would pay either 5% or a very small copay. Well, in 2024, they are making it so that when you get to $8,000, you're covered at 100%. And that's something that has never been done, to my knowledge, on that prescription drug coverage. It was always sort of open-ended, but now they're making it you're covered at 100%. When we're talking about that $8,000, we are talking about not only what you pay, but the manufacturer discounts, which can be pretty hefty. So if you're taking something like Enroll or a brand name medication, you're going to see a significant manufacturer reduction on those costs. So it's not quite, you get to $8,000, okay?
All right. We do have a couple of questions here for you, Rose.
Yay!
Get ready. Get
All
ready.
right, I'm ready.
First one's a softball. We got this one. How long do consultations with you usually last?
How long do what, Glenn?
Consultations.
Usually the first time I kind of do this Medicare 101, I ask you first, where are you? Because some people are very well read about Medicare. If you know what you want, that's fine. If it's more of I listen to what you want and your situation, so it can vary. The first time we talk, maybe it's a half an hour. And then I get a good idea. I send you what I call a request for information, like the names of your doctors, your medications, your favorite pharmacies, because one pharmacy has a contract with one carrier more so as a preferred pharmacy rather than a standard pharmacy, so there can be a big difference in the cost of your medications. So I do send out a request for information because it's all about you. It's, so I look into making sure your doctors are in the network, your medications are in the formulary, how much it's going to cost, and then I send you that information. I always like you to see everything that I see, so you look it over, and then I always recommend to my clients, look it over, call me up, and then say, okay, Rose, what the heck did you send me? Can you please explain? And then I explain what's going on, why this plan versus the other plan. I think once you see really solid numbers and how the plan's going to roll, that kind of speeds up the consultation. And then once you've decided upon a plan, we schedule what we can call a compliant presentation, because we have to do everything, the right way, especially with Medicare, because we all have licenses. So the actual compliant presentation can take probably 30 to 40 minutes. And and by the time that is over, you are enrolled, buttoned up, and ready to go. And then we follow it up just to make sure you got your ID cards, your welcome kit, any questions you have. I mean, we're always asking you, do you have any questions? Is there anything, we want to make sure that you understand how the plan rolls, what is in the plan, so that you don't say, well, my agent never told me about that. No, we go over the information and make sure that you understand clearly what you're enrolling into.
All right. Second question. I will turn 65 in January and my wife in June. Currently, we're self-employed and it's an individual plan with an HSA and a high deductible. Insurance needs are through Cornerstone now, or our benefit solutions. Do I enroll, and is it possible to keep my wife on the existing plan?
Yes, hopefully, since she's younger, if you're on an Affordable Care Act plan, she is the policy holder, because it's easier to drop the spouse, the older person off of the plan, and just have the younger person stay on the plan. As far as an HSA, that's a really good question. If you enroll in Medicare Part A and or Medicare Part B, you as that individual can no longer contribute to your health savings account. So depending upon who the account holder is, if in this particular situation, and I'm going to just say husband and wife, if the policyholder is the husband, he's employed, he's got an HSA in his name, then when he ages into Medicare in January, then his wife should probably open up her own HSA account and contribute into that, because he can no longer, and it can't be a husband and wife contribution. It can only be a single contribution once she takes over the HSA. So just be aware that, most people think, well, I've got this HSA, like you're an employer plan, and I elected Part A because it's at no cost to me, and they're still contributing to their health savings account. You're not supposed to be doing that. Just remember that if you are employed, when you are deciding to go on to Medicare, when you look at your Medicare Parts A and B, your Medicare Part B will be a future date, like when you are going to come off of the group plan. But your Part A is going to go back 6 months or to your birth date, whichever is less. And then, so stop contributing to that HSA 6 months before you plan on retiring or going on to Medicare Parts A and B.
All right. Next question. I am still working full-time on a group health insurance plan, but I have Medicare Part A and B. Is there any upcharge or penalty for enrolling in Parts C and D when I retire and group health insurance ends?
No. You have Parts A and B, you're on a group plan. Assuming you're probably on a group plan that's less than 19 employees. They're losing group coverage is a special election period where you can enroll into a plan. So, and there's a time limit, I personally, especially for Medicare Part D as in drugs, I don't want you to be without drug coverage for more than 63 days. So usually I like the transition to be, you're coming off of group, the next day, boom, you're on Medicare. So, so there's no real issue there. We can help you. Mm-hmm.
All right. If you have an existing health condition, can you be refused coverage when you sign up for a supplement and or advantage plan?
On a supplement, if you're in the first 6 months of guarantee issue, no, they don't ask any questions. So, and that is all triggered by your Medicare Part B effective date. You have to have A and B, but it's all the 6-month open enrollment period for Medicare supplements starts on your Part B effective date. So after that 6 months, yes, they can deny you coverage or just say, no, we're not interested. On a Medicare Advantage plan, they don't ask any medical questions, so you can enroll into that plan. As long as you have your A and B and you have a qualified election period, you're good to go.
All right, and this is the last question we have. Is dental insurance worth it? Many offices do not accept it, especially Medicare insurances, and what they do cover seems to be pretty minimal.
That's a good question. If we can find your doctor in network with a dental plan, then I think it's worth it. Especially, it depends on your dental health. Crowns, bridges, dentures, all of those things are very expensive. If you go to an in-network provider, I think it pays for itself. But a lot of dentists these days are not taking any coverage. And there are plans that are PPOs that cover in and out of network benefits. It really depends on your dental health as to whether that dental policy would be worth it to you. Dental policies can, for a decent dental policy, they're probably around $30 a month per person. So you need to take that into consideration and your health itself.
All right, it looks like that's all the questions, Rose. You want to go ahead and wrap it up?
Okay, well, I just want to say thank you for joining us. I really appreciate you taking your time out of your busy day to listen to Medicare 101. Again, I have my information on the screen, so don't ever hesitate to give me a call. I can be reached at 513-487-5389 or my toll-free number. I am licensed in 11 states, so and most of them are up and down I-75. So just, be aware that I can help not only you or your friends, and most of the people that call me are referrals from my current clients. So, and I find that that's the highest compliment anyone can give me, that I've done a good job for them, that they recommend me to their friends and family. So it's an exciting job, and that, there's never a dull moment and everybody has a little different thing going on. So I just want you to give me a call. We can talk about it. We can see if we can help you out. We look forward to being of service to you and your friends and family, and hope you have a wonderful day. And thank you for joining us, and have a blessed week. Take care. Bye.
Thanks, everyone.